Today, we're answering the question, at what age can somebody get their tubes tied or permanent sterilization done? The answer is both simple and complex. My name is Dr. Eric Schmidt. I'm a board-certified OBGYN, minimally invasive gynecologic surgeon, and welcome back to another video in the 30 videos in 30 days where we're trying to raise money for gynecologic cancer awareness. If you're able to give, $1 or $2 goes a long way. There's a link below in the description. We're going to be talking about the simple answer to this question and also all of the complicating factors. The simple answer to this question is it often varies by state and insurance. But as far as state laws go, the minimum age which someone can get their tubes tied is often 21 years old, with some states saying they would do it at 18 years old. For example, here in Washington, where I practice, it's 18 years old as the minimum age restriction. There's 21 years old. I'll put up a map right here which shows these restrictions. The light blue is 18 years old. The darker blue is 21 years old, and there's some states that don't have an age restriction listed. The first complicated factor, as you may have guessed, is insurance. Some insurances may have their own age cutoff or require prior authorization if that person is of younger age, let's say under 25 years old or under 21 years old. And so this may vary by insurance, and so there's a lot of different insurances out there. So if you have this specific question, you probably always want to start there. Let's talk about state insurance specifically. They almost unanimously say by state, with state insurance that someone has to be 21 years or older to get their tubes tied. And there also are some papers you may need to sign that say you understand this is a permanent procedure. It cannot be reversed. And so someone cannot get pregnant naturally after this. But, someone could, as a side note, get pregnant with IVF after their tubes are removed. But when someone is making this decision for this, we try not to have that necessarily be in the decision factor. We want to make sure that somebody is, in fact, not wanting future pregnancies. And my point number 3 is that sometimes there can be a waiting period from signing this piece of paper from the state insurance to getting it done. And this is an unfortunate situation, in my opinion, where they say there is a reflection period, which somebody has to wait. Usually it's 30 days after signing this state insurance paper to get their tubes tied. And I say it's unfortunate because usually if somebody's coming to talk to me about wanting to get their tubes tied or removed, they've likely thought about it for a very long time, and they're likely very certain they want to get this done. Now, some people are still in their decision process, but usually people are quite certain. And so after we sign that paper at that initial visit, unless it's done already for some reason, we usually have to wait 30 days, and that paper is good until 180 days. And so if it's done after that, you'd have to sign it again. Another complicating factor is that let's say that patient that has a history of C-sections wants another C-sections, but wants their tubes tied or removed at the time of their C-section, and they don't have that copy of that paper, and they can't get it from the office that they signed it with, and let's say they go to a different hospital because it's an emergency, that hospital likely won't be able to do that tubal ligation procedure because they don't have that paper with them. And the way that the Medicare or state insurance operates is that if they don't have that paper there and ready, they will not pay at all for any of the prenatal package, which obviously can be a pretty big hit to the system. And so just one of the unfortunate situations that I've seen before. Now let's talk about the last point, which is the risk of regret. Now, if a patient is pretty certain they want their tubes tied, they're 25 years old, they have 2 kids, and they're really certain they want this. Well, there are a number of years before their childbearing years are over. And so life changes, situations change. And so there's always this potential chance where someone may regret getting their tubes tied because just situation in life changes down the road. This is very hard to predict, and they did do a couple studies really looking at this. And so a study 20 years ago said that if somebody is 30 years old and they get their tubes tied, their risk of regret might be as high as 20%. Whereas if somebody was older than 30 years old, that risk of regret was approximately 6%. There was a more recent study or review of women that got the tubal sterilization procedure done that also showed that maybe it was a little bit lower more recently, approximately 12 to 13% risk of regret for people around or less than the age of 30. So a range of 12 to 20% potential risk that if someone is younger than 30 years old, they may regret getting this procedure done in the future. And I think this point, unfortunately, has led to too much paternalism when it comes from providers about patients saying, I want to get my tubes tied, and they're saying you're too young. That isn't an answer that you should get unless potentially you're under 18 years old. But yes, if somebody gives you the answer of you're too young to get your tubes tied and you're 25 years old, that's just incorrect. While that doctor is probably thinking of these potential studies which showed increased regret for that age group, it really shouldn't be up to the doctor to make that decision for you. You have likely thought about this for a very long time and either have completed your family or decide you don't want future pregnancies. And so now there needs to be better job at reducing the amount of paternalism from providers saying, no, you're too young for that. Try something else. When in fact, if somebody has thought about this for a long time and has a logical thought process about it, most providers should be willing to do it for almost any age group, and with a few exceptions like under the age of 18 or 21 years old. And the role of the provider is to provide the information that says, you know what, studies were done on this. The risk of regret for you if you're under 30 might be a little bit higher, potentially up to 20%. Every individual's situation is different and everyone is at different points in their life. So you shouldn't feel that pressure to say, you know what, I have to look into some other form of hormonal or other contraception because my doctor said I can't get this done. That was all long-winded answers for the complicating factors that go into, is somebody too young to get their tubes tied? And so by chance, if you've been told you were too young to get your tubes tied and you're older than 21 years old and you're certain you want to get this done, you should get a second opinion. Because in reality, you know your situation the best, and we are just here to help give you what you believe is best for you. Again, 30 videos in 30 days, link down below for the fundraiser. Hope you guys have a great day.